Hello Malaysia, hello world. Apa khabar? Welcome back to ECM Talk. Yes, we are still here and glad to know that all of you are here with us too. Thank you guys. Today's topic, herd immunity. Will we ever get there? The two words that are widely spoken by everyone during this pandemic, herd immunity. What is it? I talk about it, you talk about it, everyone talks about it. Herd immunity, also known as population immunity, is the indirect protection from an infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infection. Herd immunity against COVID-19 should be achieved by protecting people through vaccination, not by exposing them to the pathogen that causes the disease. Vaccines train our immune systems to create proteins that fight disease, known as antibodies. Just as would happen when we exposed to a disease, but crucially, vaccine works without making us sick. Now let us hear more from my guest today via Zoom call, Dr. Ahmad Yusuf, a lecturer from the Faculty of Medicine of SEGi University and also the Chief Coordinator of IMARET, which is IMAM Response and Relief Team of Malaysia. Salam, Dr. Ahmad Yusuf. Welcome back to ECM Talk, sir.
Waalaikumsalam. Thank you for having me here, YM.
Yes, I will. Let us go through this. There are some questions, or rather some queries that I want to go through with you with regard to the topic for today. Now, Doc, perhaps you can share with us first, your understanding what is herd immunity and how can it end the COVID-19? Everybody talks about it, you talk about it, I talk about it, everybody out there talks about it, but do we understand what it is? Please, Doc. Yeah.
Let's start with understanding the definition of herd immunity before we talk about how it can actually fight to the COVID-19 pandemic that we are facing now. If you want to define it word by word, it is indirect protection from any infection disease that happen when most of the population is immune to that particular pathogen. So we are talking about not individual immunity, but protection for the whole population, if we may say like that. But to fully understand the herd immunity in the context of COVID-19, we must first understand the two things: chain of infection and also the immunity itself. So what is infection disease? Very simple. It is a disease that caused by pathogens like virus or bacteria that can jump from one person to another. That is the key word. It is transmissible. That's why we call it transmissible disease. And in order to stop the transmission of infection, we must break the chain of infection. And we have been talking about breaking the chain here and there from the beginning of the pandemic more than 1 year ago. But again, does we understand the meaning of breaking the chain of infection? Now, the chain of infection defined as a certain condition that must be met, or an event that must happen in order for the whole infection disease to be spread around. So whenever we talk about, for example, wearing masks, it is to eliminate one of the component of the chain of infection, which is entry route and exit route of the virus. So we are wearing masks to stop the virus to exit from our body or to enter our body. That is one very simple example. Or another one, we can talk about physical distancing. We are actually removing the possible distance that the transmission can happen. So that is concept of chain of infection. If we want to understand the herd immunity as a whole, we must start from understanding how to break this chain. And one of the way to break the chain of infection is by preparing our body with what? With immunity. And that is when the role of immunity is important in fighting COVID-19. Now, if we are talking about immunity, it is the body ability to resist a certain pathogen via the immune system. How can we have immunity against any infection? Very simple. You get the infection, you will get the natural immunity. All right? At least after you are recovering from infection, you will get a certain amount of time with immunity from the infection in your body. But we have another way, which is much more, we can say, less complicated, because it is not involving us exposing ourselves to the disease itself, which receiving the vaccination. That is where the herd immunity in regards to the vaccination is important to fight the COVID-19. So how does vaccination can lead to herd immunity? Now, vaccination first, it can, in regards to the COVID-19, it can protect our body for from the severe type of the COVID-19. That is what has been proven, and what has been what we are talking about, around the world, in the other country and in our country. We are talking about this. We talk about the fully vaccinated frontliners that has been vaccinated a few months ago. The numbers of COVID positive is still there, but the percentage of category 3 and above is very, very less. Means that the vaccination actually protecting them. So that is one, what we can say, objective. The second one is actually to reduce the possibility of spreading the virus. And that is our goal when we are talking about herd immunity. If more people become immune against COVID-19 in our population, the chance of spreading will be lower. And if that's so, now you can ask me, YM, why not we vaccinate everyone? Make it compulsory. No, I wish we can do that. But there are certain member of population that their immune system are too fragile. They cannot handle the vaccine because of their own body capability itself. So they are unable to develop their own immunity. Like the elderly person, very young children, immune compromised person. So here is where the concept of herd immunity is important in giving protection to the whole population. It's like if you are standing under the rain, and if 80% of us has umbrella and we use it, then the 20% without umbrella amongst us will also be covered and protected from the rain. That is the simplest way to talk about how the herd immunity can cover those people without vaccination. And to achieve this,
a simple analogy.
Yes. And when we talk to orang asli, for example, we use that kind of analogy. If we can cover ourselves, yes, good. But if a lot of us can cover these few people that cannot be vaccinated, that is actually the goal to achieving the herd immunity. And to achieve this, we need to vaccinate our population as much as possible. That's one. As fast as possible. That's second one. So as much as possible and as fast as possible. That will be the goal in achieving herd immunity.
Okay. Now, Doc, now I like to ask you more in your capacity as the Chief Coordinator of IMARET. Now, IMARET is actively doing the mobile PPV. Now, can you share with us what is this mobile PPV and what has triggered IMARET to start this, and how has it, or in a way, benefited the community that you visit or you see?
All right, mobile PPV is an outreach vaccination program, which targeting a specific group of population. So the health authorities, for example, now is working very hard to increase the number of vaccination every day. As I mentioned earlier, to achieve the herd immunity, two things: as much as possible and as fast as possible. So
Right.
COVID-19 vaccination center or PPV is everywhere now. They are, those PPV under the Ministry of Health, those private PPVs, the GP clinics, and the PPV mega or mega PPVs. So those are the normal setups that has been done by our health authorities in order to give vaccination to the people or to our population.
Right.
But all these PPV required us to go to their location to get our vaccination. I think most of us get by this method. We go, we get registered, we wait for our appointment, and then we go to that particular PPVs that are allocated to us, and we receive our vaccination. But there are certain people in our community that don't have the ability to come to the PPV, even
Exactly.
though they are actually eligible to receive one. So we are talking about the bedridden patient and their caretakers. It's very difficult to bring the patient to go to the PPV themselves. So why not? It is difficult for them to leave their house. So if they can't go to PPVs, we can bring the vaccine to their home. So that is the mobile PPV. And IMARET is working with the related agencies like Ministry of Health and also the Welfare Department to actually identify the bedridden patient that, of course, eligible for vaccination, and arrange a visit to their home to vaccinate them and their caretakers. Why we do this? For example, over the last weekend, we had 20 volunteers working in 5 small teams, visited 17 bedridden patients at their home. Why we do this? Very simple. We want to help the nation to vaccinate as much people as possible as fast as we can. That is our objective. If we can remove the obstacle, so more people getting their vaccine, why not? If they can't come to PPV, we go to them. Because in this fight against COVID-19, no one should be left behind, YM.
Right, I agree, Doc. Now, when you go out to this special people or special community, now, do you get good feedback or do you get resentment from these people?
I think, for example, I give you a family last weekend. When we received the list of name of caretakers, where we received 8 names, means that the patient and the whole family in that house, they give us the name, not we ask from them. Means that they want to get vaccinated. And when we arrive at their home, miraculously, all the other family members has been vaccinated at least first dose. Means that in the past weeks, they already received their appointment and they went and get their vaccination, except for the patient. So they take turns to go out to the vaccination center and get vaccinated, but the patient is at home, cannot go out, and they are waiting for us. And what we receive from the patient is a thankful note, and also some cry because they are afraid for the safety of their mother, their child, their disabled child, that because they cannot bring them out. And after I share these works in my social media, more and more people actually direct message me and ask, I have bedridden mother, I have bedridden siblings. How can we call you to vaccinate these patients? Means that everyone want to be part of this fight against COVID-19. Everyone want to get vaccinated.
Right.
We just need to help them to get
Right.
vaccination. Yep.
So in other words, the message has got across to them in a very positive way. Yeah.
Definitely.
No.
Definitely. We want to eliminate the reason of not getting one.
Right.
Yep.
True. Okay, Doc. As we all know, there are several brands of vaccines available now in the market. Now, I don't want to specifically ask you which is the best and which is the least best. Now, is there a way that we can choose, or we just, are they all the same? What's your advice, Doc?
All right. Now, actually, this is a very popular question. Not from far away, from family members. You know, my mother asked me, siblings asked me. You know, friends in campus asked me about this. You can do all your research you want. A lot of people have done it for you. You can you need to Google up and read about it. You can study each one of them. You can, make all your comparison tables. You can do this. Debate about it all you want. But let me tell you a secret. The best vaccine, if you want to know, if you want to ask, you can ask me specifically, what is the best vaccine? The best vaccine, the COVID-19 that available is actually the one that is available first for you. So now it is not the time to compare brands. Now, like I said, as much as possible, as fast as possible. Now, all the vaccine has been studied to initiate the immune system, all right? To initiate the immune response, and so we have antibody against the COVID-19. So, when maybe when we are done with the pandemic, I'm not sure, maybe next month, maybe next year, maybe next decade, we don't know. Yes, when we are done with it, you can choose. You can pick your brands. You can choose which one to go to Europe, which one you can go to Saudi. But while we are being choosy now, as we speak right now, we cannot even get across the state for Hari Raya Aidil-Adha. So we are in this fight where we need to eliminate all these small things, and we need to focus to a bigger objective, which is to achieve the herd immunity. And talking about brands and to choose, that is not the time at the moment. Unless there are certain things, for example, a certain condition that from the medical perspective, that there are certain vaccine that are suitable for them. For example, certain diseases, certain patient with some allergies to a certain condition. So they do have some preference. But if we can receive any of them, the one that first come to you, that is your best choice of vaccine.
Well said, Doc. But the situation is, or rather became what it is today, when people start doubting or being uncertain on the safety of the vaccination. It's what they hear and what they see sometimes is created out there in the social media, Doc? That's what it is. Now, talking about all this, Doc, from your point of view, what do you think can we do to convince these people that it's important to have the vaccination, whatever the vaccine is, and also now as we know about this what we call this anti-vaccine campaign that's going on. What's your advice about this, Doc? All
right. We have been dealing with anti-vaccines, we can say propaganda, or anti-vaccines movement for decades, from many years before. Time to time, whenever there is an outbreak of a certain conditions that require the vaccine, then they will appear. Let me tell you, this population or these people are actually very minority in our population. They are very minority, but their voice is very loud, especially in the social media world. But if I can speak directly to the anti-vaccines, you are actually among that 20% that I can consider cannot be vaccinated. So, and we are here to protect you. So keep your belief to yourself and let us vaccinate as much as possible for those who really want the vaccination, and to all the others that are not anti-vaccines. This is the time to trust the expert in medical health and fight this battle together. So I can't remember when we being picky about vaccination when we are talking to in, for example, BCGs, for our children, for our infant. We never ask about brands to the doctors. We never ask about all those questions. But now, because more and more people talking about this, people share in social media, so that's why it looks bigger. But if we look at the rate of vaccination now, people are queuing to PPVs. That means that people at large actually want to be vaccinated, want to fight this COVID-19 properly. And when it comes to transmissible infection like COVID-19, it is not about us alone. It is not about our own immunity or antibody. It is about everyone around us. So, to make it simple, let's help the nation to win this battle. Like the tagline said, lindungi diri and lindungi semua. So it's not about us, it's about everyone. So let's get vaccinated and let's win this battle against COVID-19.
Here, Doc. Well said indeed. It's so encouraging, and it's personally, even for myself, I feel at ease listening to what you have shared.
Have you got your first dose or second dose?
I've got my first, and I'm going for my second next month. Yes. Alhamdulillah. Yes.
Alhamdulillah.
All right, Doc. Thank you so much for sharing your thoughts and views on this. And it has been very interesting sharing. Thank you so much, Doc. Yes.
Thank you again. Maybe if any of the viewers want to know more about what we do, you can go to our social media, Instagram, Facebook, IMARET Instagram and Facebook.
Right.
We do need volunteers. We do need feedbacks from from you guys. How can we go more, in regards to vaccination, the population that need.
Right. Thank you, Doc. Thank you so much. Have a good day, sir, and take care.
All right.
Thank you, Dr. Yusuf, for being in our program and sharing your views and thoughts on this subject. The proportion of the population that must be vaccinated against COVID-19 to begin herd immunity is still quite vague. This is an important area of research and will likely vary according to the community, the vaccine, the populations prioritized for vaccination, and other factors. Achieving herd immunity with safe and effective vaccines makes diseases rare and saves lives. Herd immunity is the key to control the spread of COVID-19. Once again, thank you, Dr. Yusuf, and we look forward to see you again in our other programs. My parting words, ECMians, please don't forget to like, share, and subscribe to Edu Channel Malaysia. Until we meet again, take care and stay safe everyone. Jumpa lagi.